This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Now, you can help fight pancreatic cancer by participating in Purple Stride later this month. Money raised by the walk helps support research into the disease right here in Portland. Here to share how they're helping in the fight, we welcome from Providence Cancer Institute, surgeon Pippa Newell and researcher Michael Gough. Good to have you both with us.
Thanks.
Thank you.
First, tell me about the research that's being done right here in Portland and how it helps people here in Portland.
Why don't you start?
Sure. So, the purpose of research, of course, is to move things forward. Where we are right now, if we were found acceptable, we could stay where we are. But for pancreatic cancer, we already know that the treatment options for patients with pancreatic cancer are just not good enough. And so the purpose of our research is really to find new treatment options to improve the outcomes for patients with the disease.
And doctor, tell me about what's the survival rate for most people diagnosed with pancreatic cancer?
Well, it's not so good. It really, people's chance at surviving 5 years is really affected by whether their disease has spread outside the pancreas at the time of their diagnosis. Overall, taking everyone into consideration, it's less than 10%
Wow.
5-year survival.
That's
And the real, what we find so hard is that the survival for pancreatic cancer has not improved over the past 20 years as many other cancers have improved, you know. So that's kind of why we're hoping, you know, immune therapy, for example, has improved survival for breast, lung cancer, many different types of cancer.
Melanoma.
And in and in pancreatic cancer, we're just trying to work to understand why doesn't immune therapy work as well in pancreatic cancer? And are there patients where they're sort of the environment, the immune environment within the cancer either can be sort of altered to allow immune therapies to augment the response to, say, traditional chemotherapies,
right,
or others where they have the immune cells in there already, you know, can we sort of amplify that response so that they really have a better chance at long-term sort of disease-free survival?
Is part of the low survival rate because it's found later because people don't recognize symptoms? And let's talk about what are some of the symptoms, because they can...
Yeah, the symptoms are very sort of vague, right? So people sometimes have sort of this upper abdominal pain, could be many different things. Unexplained weight loss is quite common. Sometimes people have no pain, but they develop jaundice or, you know, yellow skin or yellow eyes, and that's sort of an indicator that something is awry that helps us actually sometimes find the cancers at an earlier stage.
Dr. Gough, as a researcher, what have you found? What's been the latest news?
So the thing we found very exciting is, although pancreatic cancer has lagged behind other treatments in terms of how well immunotherapy works, a recent study published with Pippa was showing that the more immune cells the patient had in the tumor, the better their response was to conventional treatments. So to the treatments people are getting already, surgery, radiation, chemotherapy, the more the patient's own immune system was recognizing the tumor, the better they did. And that has a couple of outcomes for us. Is one, if for those who don't have a very strong immune response, we need to figure out ways to improve it. And then the other piece is why, if the immune response is playing such a big role, why aren't we seeing the amazing responses to immunotherapy we can see in other diseases?
Do you two work together?
Yes.
We do.
Explain how that works.
So it's kind of fun. We've got an office in a similar area, but Pippa, of course, is the surgeon who's actually, she's in contact with the patients, and as the scientist, I'm very much not. I'm back in the lab, and we have our own skill sets. But
well, for example, so I would meet the patients, and really the patients need to understand why, you know, if their tissue is being used for research, what's the purpose? And, and we have, you know, currently one of our clinical trials is actually involves harvesting the patient's immune cells from their blood and their tumor, and then trying to generate a way to give back the immune cells that respond to the cancer, trying to give those back into the patients. And so this is all very, you know, the patients need to sort of understand, and that's one of my jobs, is to talk to them about it. But also, I think with Michael, we, in general, sort of when we're brainstorming, well, what's feasible? Like how can we introduce, say if we have sort of an agent that could be introduced in the tumor, how are we going to do that? Can we do that surgically? Could we do that through a scope that goes down the patient's throat to inject into the pancreas? I mean, these are things that we kind of talk about.
And there are, it's very much a team event, particularly for pancreatic cancer. There are currently at the Providence Cancer Institute, there's over 250 clinical studies involving cancer treatment, and approximately 50 of those are the earlier stage phase 1 clinical trials, which means brand new agents coming to patients. And some of those are pancreatic cancer. And so there's a big team of people working to try and make it all come together.
There's hope around the corner.
I think so.
For sure. Thank you so much.
So.
All right, for more information, all you have to do is head to our website, click on Lifestyle, and then on the Family Matters icon, you'll find more information about Providence Cancer Institute clinical trials and cancer support services, as well as Purple Stride coming up September 29th.